Throughout history, there have been a lot of myths and a lot of claims of men doing things differently than women. And even in modern society, there are men that may say phrases along the lines of, I take it like a man, or I do it like a man. Or sometimes in a very condescending way, they may say things to men, you throw like a girl, or you hit like a girl. And we find and hear how there's still a residue of a lot of the toxic beliefs that we used to have, and that sadly still to a certain extent exist, of some sense of superiority on behalf of men. But when we look at what defines a man and a woman, it really brings about oftentimes stereotypes of men and women, but not necessarily understanding what really makes a man and or a woman. To understand this better, we have to look at gender and sex. And as you may have already read, gender refers to behavioral, psychological, and social characteristics of men and women that isn't always the case, that isn't always associated with sex or the sex of the individual. Sex is used when we're referring to the biological aspects of being a male or a female. And when we're referring to the biological aspects, we're talking about genitalia, but even more specifically, we could go back to the chromosomal makeup, specifically the 23rd pair, whether you are an XX, that'd be a female, or an XY, which would be a male. To understand gender and sex, it's important to look at nature and nurture, because it is argued that our sex may be determined at conception, our gender can actually fluctuate or vary depending on our environment. Now, this is a bit complex because it would imply that then homosexuality or anything that may deviate from our sex would have been learned. And that, of course, is not something that has been widely supported by research. But the reason why we say that these are important to consider is because there are many studies, and one specifically of Dr. John Money and Brenda / Bruce. You may have heard of this in here. In the 1960s, there was a pair of twins that was born. At the time, it was customary during that specific era to circumcise children. The circumcision goes wrong for Bruce. The doctor realizes that the damage done to the penis was extensive, and the suggestion is that they simply do a sex reassignment surgery for Bruce and raise Bruce as a girl. The doctors, based on the recommendation of Dr. John Money, the parents, based on the recommendation of Dr. John Money, agreed to this particular procedure, and the doctor said that there would be nothing wrong with this young boy who would be raised as a girl, because ultimately it is how you raise them, the environment. Adhering to the John Watson teachings, they were all byproducts of our environment. Well, they moved on with that particular idea. They started dressing Bruce as a girl. They named Bruce Brenda. And as we go through this growth and this development of this child, Brenda always feels as though she was trapped in the wrong body. Brenda seems to have always known that something inside her was different than what was outside. As she approached the puberty in the pubertal years, there were hormones that were administered so that we could basically inhibit all the masculine first and secondary sex characteristics. But sadly, this was not good. Eventually, it got so bad, and Brenda battled with depression that the parents and others had to tell her at the time that she was born a male and that she had been raised as a female. Sadly, they try to relive their life and claim their life differently, but sadly, Brenda, living under the name of David now, committed suicide because of the psychological damage that had been done. And so when we look at this terrible case, we look at the importance of, again, our genes, our makeup, biological makeup, but also the environment and how both contribute to what defines people as either men, women, or non-conforming. When we look at this picture, we are asked to be able to tell whether we're able to spot the female here. And unfortunately, we don't have access to who the female are, although every time I've asked in class, there are people that sometimes point to this individual here, and I say that this individual here would be a female. There are others who have said that this individual here is a female. However, the answer is we don't know. In fact, for all we know, these could all be males or they could all be females. And this again goes on to show how difficult it is to tell them apart, especially when we are younger. As you will learn later, and you may have read in other classes, we're all born, we're all conceived, and by default we're all female. It isn't until after that the presence of the Y chromosome in men starts giving way to the Sry gene that then starts bringing about specific characteristics of what men may look like, and this is accentuated even more so after puberty. But please, again, keep in mind that there are a lot more things in common that we have at the beginning than we do than we don't have in common. As stated earlier, the chromosomes that we have as humans is 23 pairs, 23 received from mom and 23 received from dad. The 23rd pair is basically what typically determines what you and I are biologically. So the XY would basically give way to a male, and the XX would give way to a female. Please note that there are some variations. We'll be discussing a few of those later in different slides. When we look at our cells in our body, all of them, except for the gametes, which are sex cells, are considered somatic cells, and they contain all 23 pairs of chromosomes. That is 46 in total. And these are what we call diploid, just like we see in here. However, our gametes, which are basically our sex cells, they do not contain 46 chromosomes. Instead, they contain half of the number of chromosomes. That is to say that when we were conceived by our parents, we had an egg that had 23 haploid, 23 chromosomes, and then the father contributed to with 23 chromosomes in the sperm. Combined, this gave way to the diploid, and that's when you and I begin to develop as a zygote. Please note that the sex is determined at conception. We're not referring to gender yet. It's only at conception. And we find the development of the sexual characteristics will start adhering to whether we have an XX or XY, but this is not seen until weeks after conception. Please note that there are some developmental variations, and these can significantly influence how a person feels and how they are attracted to different activities, to different lifestyles, including romantic partners. As you already know, the common gestation time period is 9 months, and we start seeing that between the 4th and 6th week, the gonads begin to develop, and that's where we start the sexual differentiation shortly thereafter, about weeks 7 and 8. Now, the sex chromosomes basically control the development of our internal sex organs, and that is our ovaries and testicles, and external sex organs, or the penis or the clitoris. Now, in the embryo, which is typically weeks 8 to 12, the hormonal development will also begin to contribute to more differentiation. That is to say, the way the bodies develop, the organisms develop into something that may be similar or different. When we look at the brain sexual differentiation, we're basically referring to whether, like we look at women who have a cyclic hormonal pattern, and that cycle typically is seen later when we get to adolescence and puberty, when that cycle that lasts 28 days gives way to ovulation and reproductive purposes. Men have what's known as a non-cyclic or non-cyclic hormonal pattern, and that is that we do not go through those 28 days. The reproduction is ongoing. Here you can see a breakdown of the internal sex organs and when they form. And I'd like to point out to the 7th and 8th week after conception. I'd like you to see that the gonads, which are the ovaries in females, and the testes in males, when we look at the presence of a Y chromosome, what that does is that it actually gives way to the development of us carrying the SRY gene. And the SRY gene basically stands for sex-determinant region gene. This particular gene will contribute to the sexual differentiation and development in males. That is to say, testosterone, that is to say, primary sexual characteristics, secondary sexual characteristics, all these that we see in men traditionally would be there because of the presence of the Y chromosome that then gives way to the SRY gene. When we look at the 10th and 11th week, the gonads become ovaries, and with the absence of the Y chromosome and the SRY gene consequently, then women start developing into the form and differentiating into the female body that, again, has a cyclical hormonal pattern. As stated earlier, the default setting for all organisms is that of a female. With the presence of the Y chromosome and SRY gene, males would develop what is known as a Wolffian duct, and that is the primitive duct system, a pair of structures in the embryo that, when exposed to testosterone, will eventually develop into the male reproductive system. With the absence of the Y chromosome and also the SRY gene, then the reproductive system would develop as a Mullerian duct. And again, that's also a pair of tubes in the embryo that will develop into the fallopian tubes, uterus, and part of the vagina. So again, remember, we start off by default as female, but when the Y chromosome is there, it eventually starts giving way to hormonal changes that will then contribute to the development or differentiation of a reproductive system. Once the gonads develop, the hormones control the development of the ducts into either that of a male or a female reproductive system. Here you can see how our default setting, that of, again, all individuals who are conceived, start off looking like this. This is basically the development of the internal sex organs. And this is the male development around 7 to 8 weeks, which, by the way, it's important to note that for the most part, women, females, develop and mature faster than men in all aspects, it seems. This may be the one exception as to when males may develop sooner or mature faster in something. So about 7 to 8 weeks, you could see that the more gray and faded part in the back is beginning to disappear because of the presence of the Y chromosome, which then gives way to the sex-determinant region gene. And of course, then the gonads with hormones begin to contribute to development that eventually looks like this at birth, and that is with the penis and the testicles outside, and then the tubes that again would have dropped and taken this form differentiated because of the presence of the Y chromosome. Contrary to that, if there is no Y chromosome, no SRY gene, then you could see how this, which right here, these would be the gonads, would start developing slightly different over here. This lighter side in the back is basically the Wolffian duct, but because there's no Y chromosome here with the females, then the differentiation is different here. It's slightly different. That sounds redundant, but that's the differentiation that we see here. Here you start seeing how at 10 to 11 weeks the Wolffian duct begins to degenerate because of the absence of the Y chromosome, and the Mullerian duct eventually starts taking its form into a uterus, again vaginal walls and gonads. And here is what the reproductive system of a female looks like at birth. Interestingly, this started off as something similar here, and that's what we call homologous tissue. That is to say that the tissue that you may have, for example, at the clitoris, is homologous with this here. Vice versa, the gonads here, the testicles, homologous with the ovaries, right? And various other parts that we'll look at later. Here is the external genitalia development, and I'd like you to see how there is the original default setting in here that eventually gives way to the development of the female genitalia and that of the male. Again, the only difference here is that right here we would have the Y chromosome. Here, the absence of the Y chromosome and the extra X that we have there would then give way to a differentiated body here. Look at the things that are in here. Look, for example, how the clitoris is homologous with the glans, the penis right here, and how the scrotum in here would be the equivalent also to the labia majora and various other parts. Here you can see an overall review of what the ovaries and testes produce, and in future chapters we'll be discussing how estrogen and progesterone and androgens contribute to the development of the male and female characteristics that we know biologically. It's important for us to note that the hormonal balances and fluctuations that exist, especially at puberty and then also at menopause for women when the reproductive years come to an end, and andropause for men when also that comes to an end, but that is typically till later in the 70s for most men, is a byproduct not only of hormonal imbalances but also of direct communication with the brain, specifically with the hypothalamus. You may remember from your general psych course that this works in tandem with the pituitary gland, which is considered the master gland of the endocrine system. And the endocrine system is a network of glands and organs that basically secrete and are responsible for the production of hormones, like ovaries, like thyroid, pancreas, and many other glands in our body basically work in tandem with our brain. And you will see in some slides, just in a few, how the development of our body is a very complex and elegant interaction between the hypothalamus, the pituitary gland, and specifically our gonads in here. Please note that the hormones also affect the development of the brain in the uterus, and we're talking about prenatal development and after birth. We find that male and female brains seem to differ in tasks, but there's still a lot of debates as to whether the differences that may exist between the two sexes that we've known to be the most popular throughout history, male and female, is a byproduct of nature, or if it is in fact something that is a byproduct of nurture. So we'll talk about the most basic one here, which is the how menstruation is controlled through the monthly cycle of hormones, and also how men do not have the cyclical hormonal pattern. As stated before, the majority of individuals are born with XX or XY, but there are some disorders of sexual development, and we'll be talking specifically about irregularities that exist in the chromosomal level and hormonal level, either because the hormones are occurring just randomly and the hormones are at different levels, or because of external influences. For example, mothers' exposure while pregnant to certain hormones that could then influence the development of the child. Please note again that these atypical sexual differentiations occur with not as the most common, but they do occur nonetheless. There are over 70 sex chromosomes and abnormalities that are known, and typically it is a byproduct of what's seen as an extra chromosome. Instead of 46, you end up with 47, or missing sex chromosomes. Instead of 46, 45. We'll be looking at the three most common. We don't have time to go into each and every one, but here are the three most common. Klinefelter syndrome, Turner, and XYY, and triple X syndrome. Starting with Klinefelter syndrome, as you can see, it is a syndrome that has an extra chromosome. Instead of the individual being born with 46, born with 47 total. The prevalence is a bit high, 1 out of 750 live male births. And that basically tells you that although there are two X's here, because of the presence of the Y chromosome, it is considered a male biologically. This Y chromosome contributes to the development of male genitalia, but it doesn't develop fully because of the extra X chromosome. Think of it as kind of double teaming on the Y, and the Y can't do its job as it would if there had only been one X. So the body develops into this tall yet feminized body with small testicles, and gynecomastia, which is basically abnormal male breast development, would be there. Because of the extra X chromosome in there, testosterone levels typically don't reach a usual level. And because of these low testosterone levels, there's typically a low libido, low sex drive. Infertility is not unusual. Erectile dysfunction, mental retardation are also common. And we find that secondary sexual characteristics, like physical characteristics other than the genitalia, are also affected by this in here. Those who are diagnosed are typically identified during an evaluation for infertility, that is to say later in life, not necessarily at birth. So about 2 out of 3 men are never diagnosed, so it's not a good thing. Oftentimes with low sex drive and low testosterone levels, this can be somewhat reduced, or the symptoms could be reduced, made better by taking testosterone therapy. By increasing this in here, you give a boost to the already compromised Y chromosome because of the presence of the X, and it can help. Turner syndrome is another one, and as you can see, this one has an X and O. By the O basically means that there's missing one. You would either have XX or XY. This one's actually missing one, so we have an individual with 45 chromosomes instead of 46. This one's a little bit less common, 1 out of 2,500 live female births. That is to say, this one would be a female. The ovaries, because of the absence of the extra X chromosome, are not fully developed. And as a result of that, amenorrhea, which is the absence of menstruation, is one of the symptoms. Also, because of that, infertility, there's no ovulation, and so infertility is also going to be an issue here. This occurs if an ovum, that is an egg without a chromosome, is fertilized by a Y sperm and thus contains no X chromosome, and so this would not survive. However, if it's just an X chromosome and no other X chromosome from the other end, then it can survive and it would result in a Turner syndrome. Typically with individuals with Turner syndrome, the genitalia would develop normally, but they have short stature, immature breast development. Typically the nipples are spaced out wider than usual. Mental retardation is not an issue. It's not unusual, excuse me. And estrogen and progesterone therapy can also enhance the secondary sexual characteristics that are seen there. Although the majority of girls with Turner syndrome will never undergo puberty, those who do may be capable of pregnancy. However, the pregnancies in women with Turner syndrome have a high risk of chromosomal abnormalities and fetal loss. The XYY or triple X syndrome be either the sperm contains an extra sex chromosome, and so you would end up with an individual that has an extra Y, or the egg has an extra X chromosome, and so you'd end up with that extra. So 47 chromosomes in there. These individuals may look and behave in what would be considered within the norm, but they may have slight mental retardation, increased or decreased fertility problems, possible learning difficulties later in life. There is no available treatment for these individuals, and there are individuals that believe that those who have the extra Y chromosome may also be more likely to be explosive and more violent. This has been debatable and contentious debates really as to whether the extra Y chromosome can give way to a violent male in this case, and whether the extra X chromosome would give way to a more feminine female than average with a higher pitched voice than usual. Nonetheless, again, a lot more research is needed for this. We will now look at hormonal disorders. We are going to be focusing on two of the most common here, and that is the congenital adrenal hyperplasia, CAH, and androgen insensitivity syndrome, AIS. As we look at congenital adrenal hyperplasia, please note that it is because it's no longer a chromosomal difficulty, we are dealing with 46 chromosomes here. So XX girl is exposed to excess amount of androgen, from adrenal glands prenatally. And so this is typically the case when a child lacks an enzyme in the adrenal gland. So this forces the body to produce higher amounts of androgen. Androgen is testosterone, and as a result of that, the girl would, 1 out of 15,000 girls suffer from this in here. The girl would have female internal organs, but sometimes masculinized external genitalia. And the reason why you have masculinized external genitalia is because of the excess amount of testosterone, androgen that's there. This is sometimes seen also with syndromes that are similar that develop from mothers taking male hormones while pregnant. Sometimes corrective surgery, drugs to control the adrenal output could help alleviate this in here, fix this. But this is controversial because it's often something that we say should be done when the individual becomes an adult and they could decide for themselves. Pregnancy may be possible with individuals, with many of them. And we also see that there's a higher rate of bisexuality and homosexuality among them. So this has supported the notion that bisexuality may be a byproduct of natural factors, innate, not necessarily nurture. Today, almost all newborns are screened for CAH, and most females are diagnosed right at birth. Here you see a picture of genitalia of a fetally androgenized female. That is to say that this particular person, this infant, would have developed the genitalia differently because of the presence of androgen. AIS, our other syndrome here, androgen insensitivity, is an XY individual, so that is to say a male, but the body doesn't respond to testosterone that is produced by the testes. This appears to be a seemingly normal girl who is genetically a male. The testosterone is present but has no effect on the body. Even though they are genetically male, most individuals with AIS seem to be fully feminized and live as females. Because the Wolffian ducts did not respond to the testosterone during the sexual differentiation phase, the male genitalia doesn't develop. Usually the syndrome is undetected at birth and the child is brought up female. Because males do produce a small amount of estrogen, the breast may develop. So it is only when the teen fails to menstruate that AIS is diagnosed. The genitalia often may also be different than we would normally see. Here you can see a picture of the genitalia, and you can see how this here, which would be the equivalent of the labia majora, was supposed to develop as the scrotum of the testes, and that is what's homologous with the labia majora. This would be very shallow, and again, this was the development of the genitalia because the androgen was just not having an effect on the development of the body. Please note that transgenderism, so known as living as the other sex, is a person or group of people who identify or express their gender in a variety of different ways, typically in opposition to their biological sex. This makes up about 10 to 15% of the population. And we find that these individuals typically live the other gender's role, either full-time or part-time. However, they don't often seek a sex reassignment surgery because they're often happy with their biological sex. They're just psychosocially pleasured by dressing as the other sex. Interestingly, there have been individuals who identify as trans who also have wives and husbands and live what appears to be a heterosexual lifestyle. But nonetheless, it is something that we see individuals engage in. Billy Tipton is a well-known jazz musician who was discovered to be a female when he died in 1989. He was married to a woman who was aware of his biological gender, and he was also the father of 3 adopted boys who did not learn of his biological gender until after his death. Nonetheless, Billy Tipton never sought sex reassignment surgery. We find that transsexualism is different than transgenderism. When we look at transgenderism, we're talking about an individual who, again, feels or identifies and expresses their gender different than their biological sex. However, a transsexual is an individual who fears that their gender identity does not match their biological sex. That's what's known as gender dysphoria. And they often report feeling trapped in the wrong body. We find that there are more males than females that experience this in here. And these individuals typically seek sex reassignment surgery, SRS, which involves a long process, psychological counseling, live as other sexes, hormones, multiple surgeries. And when we look at the male to female process, the results are more realistic and they're able to reach orgasm, but the female to male is in its experimental stages and it's more difficult of a procedure to engage in. Please note that in the in pop culture and many other places, just in casual talk, individuals may identify as trannies or trans, and while that of course is something that we respect and we say it's at the purview of the individual, we do find that a transsexual be a person that be more likely to seek sex reassignment surgery versus a transgender who would just seek to express and live a lifestyle slightly different. Please note that trans women who take estrogens and possibly testosterone blockers will develop breast, a redistribution of the body fat, decreased upper body strength, softening of the skin, decrease in the body hair, a slowing and stopping of hair loss in the scalp, decreased testicular size, and fewer erections. And that is something that we see with individuals who take hormones. Over the years, sex reassignment surgery has been relatively controversial, with some studies showing healthy postoperative functioning and other studies showing no alleviation of the psychological suffering that individuals had. However, in previous years, they often even consulted with family members before they allowed a person to proceed with the sex reassignment surgery. And then over the years, it was discovered that a lot of the parents and family members and friends were not supportive of this procedure, and so that's no longer a necessity. Here you see some individuals who, after the surgery, basically allowed for the pictures of the genitalia to be taken. You can see on the left a completed male to female transsexual, and on the right you see a completed female to male transsexual. Please note that trans men who undergo testosterone therapy typically experience clitoris elongation anywhere from 1 to 3 inches in length. We also have a Phalloplasty, which basically releases the enlarged clitoris and allows it to hang a little bit more like a natural penis. There's another surgical option. It's called phalloplasty. This one's more expensive and also lengthier. This involves constructing an artificial penis from abdominal skin. Phalloplasty is a difficult procedure and as a result is much less popular today. Penises made from phalloplasty cannot achieve natural erection, so often they have to do what's known as a penile implant of some kind. And we'll discuss implants a little bit more in detail later. But overall, the metodioplasty is a less simpler, more simpler procedure than phalloplasty, which is what makes it more popular. It also has fewer complications, takes less time, and it's also less expensive. A metodioplasty takes about 1 to 2 hours and can cost around $15,000 to $20,000, whereas a phalloplasty can take about 8 hours and cost more than $65,000. Please note that this procedure here on the right is also sometimes done with men who may have had prostate cancer, testicular cancer, penile cancer, and they seek to have a reconstructive surgery that would allow them to maybe maintain as much as possible of what the lifestyle they had before.